Hello, my name is Lisbeth Becerra Torra, and today I'm going to present to you about ethical standards in the mental health and wellness field. Now, in the everyday life, we all have to present ourselves in a respectful and honest way, and the same thing we have to conduct ourselves in the medical field, whether it's tending to a person in the front desk, or you're a counselor and you're helping a client. We have to be respectful and honest with them. We have to make sure everything we do is justified, that we're not doing anything that will harm them or ourselves, as well as taking care of them, confidentiality, protecting their rights, and making sure there's always going to be a professional boundary between you and your client. Now, there's different other types of fields out there, like nursing, where they have keeping promises and telling the truth. Now, that's something that's not just nurses are using, but we as mental health wellness providers, we have to be honest and telling them the truth and making sure that we promise them that what we do here is 100% going to be the same. If there's anything that we need to change, we'll let them know, to make sure that they understand that it's something we're doing for them, to support them and to guide them for a better treatment plan. Now, there are two different concrete examples that are against the laws when we were not supposed to be doing. One is if we we're counseling a family member or a friend, we can't be uncleared our judgment. We have to put those boundaries of, you're my patient, I'm your counselor. If that becomes a problem and it affects our professionality, then we have to refer them to someone else, because we can't treat someone if our judgment is not clear at all. Second is if we're treating a client and we're trying to receive money from them or send them to some type of other private practice instead of keeping them and helping them in our own facility, then we're not doing our job correctly. If I can't do it, my counseling, then I still need to refer them to a different counselor if I can't do my job. Now, there are different conflicts that can occur when you're working with a patient if you have your own different ideals. I'm Christian. I believe in the Bible. I pray and everything, but there's certain things I personally believe in praying with just God. There's other religions that pray for different things, but I'm not gonna judge them for that. So if, say, I'm with a client and that client's Catholic and they pray to the Virgin Mary, that's something where I'll be like, okay, maybe I can't agree with that, but that's their religion, not mine. I shouldn't be biased about it. If there's conflicts in that, that's something where we're not agreeing, we have our different beliefs, or that person's not comfortable with me because I told them honestly, I don't pray to the Virgin Mary, and they don't want to open up to me, then I need to talk to someone, another professional counselor, and let them know, what, my client and I are not seeing eye to eye. We have different viewpoints. We're not agreeing. There's no conclusion to getting the person treated well. I need help because we can't see eye to eye. And that's when I can get them a better counselor to help them. We always have to think, not of us, okay, my client doesn't agree with me, then I can't help. No. If I can't do my job, then I need to find someone to help them. That's my job, to find something or someone else to help them guide themselves, to help them guide the client. There's different principles throughout our mental health and wellness profession, and there's a lot of other organizations like the American Counseling Association, American Psychological Association, and National Association of Social Workers. They all use the same principles: being respectful, honest, integrated, beneficial, non-maleficent, being justice, being confidential, always having your professional boundaries, and doing the right thing. And even though each one is used different ways they use their principles, they are all the same. We want to do our job correctly without any harm to our clients or to ourselves. Now, we do have different types of demands that can occur through our profession. One is breaching confidentiality. When you're helping a client and you're seeing this client is struggling and having difficulties, and maybe you're noticing points where it's like, okay, is this person okay? Can they harm themselves or harm someone? If they become more aggressive and you think it's life-threatening to themselves or someone else, that's when you breach the confidentiality. You have to protect your client, and whoever maybe that client's trying to hurt someone else, you have to protect them as well. So that's where you talk to someone that's close to you and your staff or your superior and be like, you know what, this client is becoming more aggressive, saying these things. I think we need to try to get more help for him or her. And that way he or she is not hurting themselves or anybody else. That's the only reason why you would break that confidentiality. Another ethical dilemma that can occur is managing dual relationships. Like previously said, if you're counseling a family, a friend, someone that you met at a yoga club or out with other friends, you knowing this person is personal, because you can maybe state something as a counselor, but if I say something individual in, say, if a person I'm in a yoga class and we're together and I say something different, they're going to be like, okay, but then why did you say this to me? So you have to know you have to set those boundaries. So you talk to your client, be like, look, I know you from this class. If that's going to be a problem of us working, me helping you, seeing our ideas could be different and we can't be professional, then maybe I need to get you a different counselor, because you want the best for them. If they're having trouble, they don't want to see you at the yoga club and be like, okay, I can't talk to them about this right now, or they feel uncomfortable around you. Things can escalate to a point if you don't set those boundaries first. Or, like I said, the best thing is referring them to a different counselor to help them, someone that they don't know, so that there is no, how we talked about, any bias or any differences of each other. Now, as we all live throughout this world, we are living through our own standards, but also trying to use these standards through our work environment. But as we have our ethical standards, I expect it as a mental health and wellness provider, we have to abide by those rules, by those codes of ethics.